21-year-old Australian Daniel O. Young is venturing out from his grandparents' home into the deserted streets of Wuhan.
See, there's a police car right over there. And what the police car is doing is it's checking everyone's number plates. So there's already been number plates that have been banned from leaving the house and being on the road. These are where all the hand soaps and everything is supposed to be. We're trying to stay away from the people as much as we can.
It's been nearly 3 weeks since Daniel became trapped in Wuhan after the city was locked down. But now freedom beckons.
So I'm super happy and thankful and grateful that they're going to be able to get out of here as quickly as possible, and that the government is moving quite quickly. It's definitely good news to be hearing amongst what's happening right now. As for me, a second plane is coming. I got an email tonight saying that the timing is to be finalized, but they're taking all of our information right now, which I've sent to them.
It'll be a bittersweet departure as he leaves his Chinese grandparents behind.
This is my grandpa and my grandma over here. So, 所以呢，他们新闻想了解一下子你们俩。I'm worried about them. They're worried about me, and yeah, but there's not much more that I can do on my end besides just keeping in contact with them and making sure that I'm healthy.
The mass exodus from Wuhan has begun for hundreds of Australians. The first chartered Qantas flight is now on its way to Christmas Island, where they'll be quarantined for 14 days.
The 14-day time is based on the likely incubation period, or period between when you contact an infected patient and become infected yourself or demonstrate infection. So that anyone beyond that, if they remain asymptomatic, are cleared because they are outside of that incubation period. The people that are being transported to Christmas Island are being accommodated there for that 14-day period. So if none of them develop symptoms during that time, they'll be completely free to come to Australia.
Professor Tanya Sorrell is the head of infectious diseases at Sydney's Westmead Hospital, where several confirmed cases have been treated.
How is it spread?
The way that it's spread is so-called droplet spread, with patients coughing or sneezing, or contact spread. So if they've coughed or sneezed onto a surface, that surface can be infectious. I think there is a lot of anxiety in the community about the potential to catch this infection. I really would like to reassure people that the authorities in Australia and New South Wales in particular, since that's where we are at the moment, have everything in place to contain this infection.
The federal government has now moved to stop Chinese nationals and other foreigners who've been to China from entering Australia. But that's now putting at risk Australia's multi-billion-dollar international student sector. Many Chinese students are now stranded back home, unable to start the university year. Students are petitioning for exceptions to be made for Chinese international students, as well as the refund of thousands of dollars in tuition fees.
I think international students should be let back in.
Student leader Abby Shi is in self-imposed quarantine after recently arriving from China.
It's a very expensive tuition fee and imposes a lot of financial burdens, together with the living costs on international students here in Australia.
At the University of New South Wales, where one student tested positive to coronavirus, some domestic students are planning to skip classes to protect themselves. Wild rumours and hoaxes on the internet have only stoked fears of catching the disease.
There's a lot of fear in the community about the disease. Can you dispel or provide some of the facts? Can you get coronavirus by standing in the street and breathing in the air?
The virus really doesn't circulate in the environment. So no, it doesn't just circulate in the air, and if you've not been in contact with someone who've actually coughed respiratory secretions onto you, or you've touched a surface where those infected secretions are present, then you will not be at risk.
Can only Chinese people get the virus?
Oh, that's quite incorrect. Anyone is at risk if they've been in contact with an infected patient.
As at least 18 countries scramble to contain the virus, Daniel hopes there'll be an end to the outbreak soon.
So I think if we're able to keep the virus quarantined and locked down in China as quickly as possible and just stop everyone taking it to other places, it can be contained and brought under control as quickly as possible.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.